COVAX, tell us about the work it did to help get vaccines going for COVID-19.
So COVAX is a global coordination mechanism, and we've done several things. We've helped develop vaccines, and now what we're doing is we're making sure that we get those vaccines distributed around the world. So far, we've distributed 31 million doses to 57 countries, and our objective this year is to deliver 2 billion doses. And the whole point about that is it means we can vaccinate 20% of the populations in those countries. That helps bring the acute phase of this pandemic to an end.
You warned of the concept of vaccine nationalism last year. Have we seen that in terms of the European response?
Absolutely. And when in last year in February I started warning about this is exactly what I was talking about. And of course domestic governments have an obligation to protect their populations. What we can't do is actually have that done at the expense of the globe and vulnerable people right around the world, because we might be able to clear out or prevent illness and death in one country, but as we know, we all want to travel again, we all want to trade, and it's also just the wrong thing to do to leave other people in the world vulnerable. So yes, we're seeing it right now, and it's not a good thing.
I guess those countries can argue though with, say, Australia, with our borders shut, etc. We don't have any cases, we don't have the urgent need that they have, and that's how it would be viewed internationally.
Look, I think there is a case in countries where they've got a really badly out of control pandemic, and that's very difficult. But let's not forget, here in Australia, we've made serious sacrifices. We have taken on a huge amount of national debt, and of course many people have lost their jobs, and that's not easy. So it's great that we can go to the pub, we can have weddings, all those great things, we can dance at weddings, but let's be honest, it's cost us a lot as well.
How do you compare the different vaccines and their efficacy and effectiveness? Yeah.
Well, one of the things I would say to people about the vaccines in Australia, take the first one you are offered, because they're both going to do what we want them to do, which is prevent severe disease and death. That's the end point we care about. That's the outcome we're trying to prevent.
When do you think enough people will be vaccinated that we can travel overseas again?
It's the question we all want answered, isn't it? I'm really hoping that we have got the majority of our vulnerable population dealt with well by the middle of this year, and then a broader population group shortly thereafter. Look, rolling this out's a challenge, we all know that. We're going to have to lift our game. As this vaccine becomes available, we now know there's 800,000 doses coming out of CSL. We'll have more coming shortly. So we need to really ramp this up. But I'm really hoping in the last quarter of this year, we'll be seeing a very different life.
Okay, so all of Australia's vaccinated, say, or 80%, 90%?
Well, not 90%. 20% of our population are under the age of 16, and none of these vaccines are approved for under 16-year-olds.
So how many percent will be vaccinated?
Well, I'm hoping that nearly all of that 80%, the over 16-year-olds, will be vaccinated. Now, we know there'll be a small number of people who can't for health reasons or whatever, but my call is for everyone else, when your number comes up, go and line up.
So let's say we have that situation, and in many other countries, particularly developing countries, they haven't vaccinated. Where does that kind of leave us in terms of overseas travel and the rest?
Well, if we personally are protected against the worst parts of the disease, severe disease and death, it should make it possible for us to travel again. Obviously, we have to watch variants, because as we know, viruses change. And people would know about flu. Every year you go for a new flu vaccine, and we change the different types of flu we're protecting against. These days we actually can put 4 sorts in the vaccine. It used to be 3. So, but we change it every year, and I suspect that's where we're going to end up with this virus in the medium term.
So you say that, and it's a good point, but it kind of worries me, because I just think, how do we ever get to normality if that's the case? But I suppose you'd say, well, that happens with the flu vaccine.
Exactly, that's exactly right. And I mean, we've been at great pains to say to people, this is not flu, and it is not flu. But if you think about how we manage flu, we protect people who are vulnerable, we make vaccine available, and then we go about our lives and we care for people who become really unwell. That's what I think we'll end up doing here.
You did a report for the government, which has been mentioned a lot on the hotel quarantine system. Yes. Labor picked up and used it quite a bit. I'm not sure if they were completely accurate with what they said about it. Anyway, it was mostly around the talk of a national quarantine facility, expanding Howard Springs. The government did that. Yep. And maybe using RAAF Learmonth. Can you take us behind what you meant when you made those recommendations around the national quarantine?
I've been pretty clear about that. The things that help you run quarantine are a couple of things. And obviously a facility like Howard Springs, with rooms that open to the outdoors, means the risk of transmission to other people in that facility are reduced. That's good. But of course, the advantage of Howard Springs, and for those who don't know, it's in Darwin, it's close to the airport, it's close to a good hospital, and it's got access to staff who can provide the care, support, etc. for people who are actually in quarantine. So what I was talking about was that kind of facility, and Howard Springs is exactly what I had in mind, to expand its capacity. And that means you can deliver the services you need and you can do it in a way that's sustainable. So somewhere like Learmonth, I mean, we've used places like that before, but it's hard to do. It's really expensive. And if there are better options like Howard Springs, that's what we should be doing.
What do you think of the fact the states ended up taking that over? Was that the right course of action?
Yeah, I do think so. I mean, the states have access to workforce. The states are literally on the ground, and much as a long-standing former Commonwealth public servant, I'd like to say the feds can do everything. Actually, in service delivery, it's not our strong suit. The states deliver hospitals and hospital services, so I think it was absolutely right.
So I'm just going to pick you up on that, because I've been making this point about the feds and service delivery. Is that an issue when it comes to the vaccine rollout?
Well, of course, they're not doing it themselves. They're actually using people who are used to delivering services, and I think that's important. So if you think about healthcare workers, the states have been engaged in delivering that. And now, of course, they're going to go to GPs, to pharmacists, I understand, and they're used to rolling out things like flu vaccine. Maybe in the medium term we'll see extra work coming to the states, and I don't think that would be a bad thing either. These are people who are experienced in delivering services. It's not the Commonwealth sending out its bureaucrats to deliver this service.
So Brendan Murphy last week discussed with me this prospect after mass vaccinations, 7-day quarantine or home quarantine when we come back from overseas. Could that work, do you think? Is that sort of an intermediate step?
Well, I think we have to look to see how this rolls out. I mean, I would suggest to you, however, once we've actually got the population vaccinated, we will need to consider what kind or if we need to quarantine people. Variants might be an issue we need to think about in terms of quarantine, but exactly the same as flu, we don't quarantine people who come into the country now to see if they've got flu. Now, this is a little way down the track, so let's not get too far ahead of ourselves. Well, let's see how quickly we roll out the vaccine. We roll this vaccine out quickly, I think it's shorter rather than longer term.
Now, you were a respected senior public servant here for years, head of health, head of finance. When people complain about the culture of Parliament and a proper complaint system, which of course finance used to deal with, there's a lot of shortcomings there, isn't there? What do you think of what's going on here at the moment?
This is a workplace, and everybody should be safe when they come to work. And you're right, there have been obviously problems for years and years and years. And so clearly this workplace needs to change. We need to have proper respect for everybody who works in this building. I don't care if they're a cleaner, if they work in the cafeteria, if they work in a senator or a minister's office. They should all be treated with appropriate respect and be provided with the right mechanisms to bring their concerns to somebody who can do something about them. It's great that Kate Jenkins is doing that review, and obviously she will go into all those issues. But I think all of us who've worked in workplaces would say if this was going on in the next door office to me, it would not be acceptable and it needs to be changed.
Now, the PM's compared it to problems in the media, problems in other professions. But is there something unique about Parliament that it has more of these issues than corporate companies with HR departments and the like?
Well, I certainly think the nature of this workplace is unique, and I think therefore it requires some very particular steps to fix it. I think people would know that people, when they're in Canberra in Parliament, when Parliament's sitting, they work huge hours. They're all very tightly bunched together. They get tired, they get emotional, and they work really, really hard. So I do think it means extra care is needed. And you've got lots of young people in this place, and they rightly want to have a good time, but they've also got to understand that respect for each other, and that's not just physically in the workplace but out of hours, is also really important. So the mechanisms that are put in place, I think, have got to reinforce that, and it's got to protect people.
There is this perception that the Department of Finance will just do what the government of the day wants them to do.
Well, I would say that's probably not accurate. I also think it's partly a question of the legislation, and that's one of the things I'm hoping that they look at. So the MOPs arrangements, as they're known in this building, mean that the employment arrangement is not between the Department of Finance and the individual staff member. I think it's probably time that those arrangements were reconsidered and new arrangements probably devised.